Cox Business Television, information and insights on the Hampton Roads economic picture. Featuring in-depth interviews, profiles, and the latest publisher spotlight from the newsroom at Inside Business. Exclusively for Hampton Roads, Cox Communications presents Cox Business Television.
Hello and welcome to CV Television, presented exclusively in Hampton Roads by Cox Communications. On this program, we'll bring you the experts, the journalists, and local business leaders who help us make sense of trends and issues impacting our local economy. This show is about leaders, powering leaders, giving you insights to help you be successful. Today, healthcare from a business perspective. That was the topic at a recent executive discussion series, the quarterly panel of experts presented by Cox Business and Inside Business.
Employers purchase 54% of the health care through group plans in this country. They want to see quality, and they want to see health improvement. They want to see a focus on wellness, prevention, screening, health promotion, etc. We know that only 55% of adults receive the recommended care when they go to their doctor. We know that 30% of what's called overuse, and that there's waste in the system and inefficiency in the system. So we are totally interested in consumers becoming more engaged and being aware of what they're buying.
I'm a firm believer in that patients also need to have a stake in their own health care. Because we have such a high obesity rate, I think it's upwards of 2/3 of the American population right now overweight. They have hypertension, they have diabetes, they have high cholesterol, they got vascular disease. I mean, you name it, they have severe arthritis, and there's no accountability to those patients to be healthier. I mean, why should you, if you're healthy, supplement somebody else who's markedly overweight for their premiums because of the way the system is currently set up?
For those who are at risk and disadvantaged, then we have a moral responsibility to look at incentives and to look at subsidies that can help to support that process. If you visit our website, you'll see the research that we've done state by state, confirming that today 20% of all school children have at least one chronic condition that if mom and dad lost their insurance, had to move into a new policy and be subject to pre-X, these children would not be covered for that condition. We must eliminate the annual caps on services, and we must eliminate the lifetime caps. We have a family here in Virginia Beach who came to visit us. They have an 8-year-old son that's been battling leukemia since the age of 2. Mom and dad are both executives, and both have changed careers twice simply to move to new health insurance coverage that would provide broader caps at a lifetime, because this little fella was already crashing through a $2 million cap.
What we're focused on, from an insurance standpoint, is really how to bend the curve. And you're going to see that there's a lot of consensus, at least in the national healthcare reform packages that are out there, that we need to be able to bend the curve to be able to pay for all this. I think all insurance companies will tell you that they're in favor of some type of reform. Some people would like to make this a revolution, and some people would like to make it an evolution. And we've got to be very methodical about how we do this, because it affects every person, not only in this country, but it will affect it in the world.
Joining me now to examine the topic of healthcare are two local leaders who are right in the middle of the issue every day. Dr. Margaret Gaglionne is the founder and medical director of Tidewater Bariatrics in Chesapeake, a small business owner and a physician focusing on wellness and preventative care. She can see both sides of the current debate. And John Wheeler is the president and CEO of Wheeler Interests, a local real estate and development company with more than 30 employees. John, your company has been featured in Entrepreneur Magazine and also in Men's Fitness over the last couple of years. You've really been highlighted as a leader, helping your company become more focused on fitness and wellness. How have your employees embraced this?
Full-heartedly. They really enjoy it, and they enjoy it coming from the top down. And it's a program that we've been working on for the last 10 years, and each year we've taken baby steps, but it's been extremely well received.
Excellent. And is this a part of, let's say, your hiring practice? Are you weaving this into both the pre-employment and as well as during the actual engagement while someone's your employee?
Absolutely. As a matter of fact, we've had several instances when people have come in and I could actually smell smoke on them. And I've sat them down and I asked them point blank, are you a smoker? And when they admit yes, of course they are, I said, look, when you have the opportunity, come back. When you quit smoking, we'd like to revisit with you.
I see. Well, That's a part of probably as we're all trying to become more conscientious about health, the smoking is one of the key ones. And Dr. Gaglionne, when we were talking earlier, you were mentioning that really interviewing employee or potential employees fully and understanding some of their health practices are part of your hiring as well.
It is. I mean, our practice is certainly important on picking people that will be role models for my patients. And so I want to design an office practice that is an environment that promotes health for all. So for my employees as well as my patients. And so that has to happen from the front door in and from the top down. So that's creating a culture that's absolutely consistent. And so that's a very important thing for my nurses, for my admin staff, for my health educators, for the doc, for everybody, that we have the same consistent thing that health promotion, eating right, physical activity are key tenets of what we do.
Okay. And it's actually, part of your concern is how you're seen in the community as well. I mean, you all are both business owners, and how your company is perceived and the health of your company, both in the employees as well as your business, is important to your public image, I would imagine, as well.
It is, and it's an opportunity for us to attract the best, and it's not only here locally, but people outside of the area, outside of the state, see what we're doing, and they're really following up on it with their own right, with their own companies, and instilling some of the things that we've worked on. For example, we have a gym downstairs called Atlantic Performance Training and Fitness, and it's an opportunity for the associates to go downstairs, lunch 12:15 for 15 minutes, and do a stretch exercise, as well as around 5:15 in the afternoon, we have a 30-minute express workout.
Wow. Well, am I right with one of the facts I was reading about is that over the last 8 years, you've only had 5% turnover in your employees?
We're very fortunate with that, and that's because we put the time, put the effort, and put the money in. But it's important to note that it's not overly expensive. And again, if you take the baby steps, it can be extremely rewarding for the associates and ultimately the firm.
Okay. Dr. Gaglionne, as you're developing your practice, are there any best practices, being both a physician and a small business owner, that you would recommend to other small business owners in this area?
Best practices in...
As far as both the hiring and actually just the way that you operate your business, where you're focusing on your employees being healthy and everything else throughout the entire day.
I think it's being consistent. I mean, I think if you decide what is your goals, and ours is certainly health promotion and treating obesity. So having those tenets up front and selecting people that will enforce those and being very clear that these are our objectives. I think that works throughout in the employment as well as for promotion, health promotion.
Well, I'm really thankful. I want to recognize both of you all as leaders in our community. Thank you for the services that you offer to your employees, but also to us, and thanks for being with me here today.
Absolutely, we appreciate it.
Coming up later in the show, two leaders in healthcare right here in our region help us sort through the issue. Please stay with us.